All right, so I was called onto the scene of a 28-year-old female who had a falling incident. We're not really sure exactly what happened. We just were alerted that she fell and she's experiencing pain in her arm and in her neck. Now, for this intents and purposes, I am inspecting the scene. The scene is safe for me to enter into. I am wearing my BSI scene safety. I have my mask and my gloves on. And now I am entering the home. And I am approaching my patient. Hi, ma'am. My name is Scott. I'm here with Westchester EMS. I'm here to help today. What happened here?
I was so much pain. I had roller skates and I just fell. I fell way too hard.
You fell hard. Okay. So what I'm seeing here is that the mechanism of injury is that she was on roller skates and she did end up having a fall. Now, because she did end up having a fall, I'm going to ask my imaginary partner to maintain C-spine and hold her. Ma'am, could you have your hand down, please? Thank you. I'm going to have my partner hold C-spine on her neck to hold her in a inline stabilized position while I conduct the rest of the assessment. Now, ma'am, what is your name?
Anne.
Anne? Okay, and Anne, where are you today?
I am in my home.
You're in your home? So you were roller skating inside of your home and you had a fall?
Yeah, I was trying to spin.
Okay.
I fell,
All right.
but on skates.
Okay. And do you know what day it is?
Yeah, it's Sunday.
Okay, and you mentioned that leading up to this, you were trying to do a spin move, and you ended up falling?
Yeah, and I fell out of the spin on the hardwood floor.
Gotcha. Okay. So now that I've spoken with the patient, she is alert, obviously, because she's talking to me. She did have a traumatic incident where she did have a fall, hence why I have my partner here maintaining C-spine. So now what I'm going to go ahead and do is begin my ABC assessment, her airway, breathing, and circulation. So, ma'am, could you open your mouth for me, please? And say ah. All right. I'm not seeing any obstructions in the airway itself. So we're going to say that she is open, clear, and maintained, self-maintaining. So now what I'm going to go ahead and do is check her breathing using the iPass gas mnemonic. So what I'm going to go ahead and do is inspect. Ma'am, could you just breathe normally for me here? And is it alright if I put my hands on you?
Yes, it's okay.
All right. So I'm inspecting. I see that she's getting adequate tidal volume. I see her chest is rising perfectly fine there. Now I'm palpating the chest. All right. And we're feeling adequate tidal volume there. So now I'm going to go ahead and auscultate her chest and just give it a listen. Ma'am, I'm going to just listen in here. Take some deep breaths for me, please. All right. I've determined that she has a clear chest bilaterally. She has adequate chest rise and fall on both sides, and I hear no disturbances in the chest itself. Ma'am, are you bleeding anywhere from your chest, or was there any injury to your chest?
No, just my arm and my shoulder.
No, just your arm and your shoulder. Okay. So there's nothing to seal and stabilize on her chest here. There's no wounds to her chest. And as far as supplementary oxygen goes, we're going to give her a nasal cannula, just a very light oxygen supplement, because we don't know what the status of the patient is going to determine to be. So we might as well just give her some a nasal cannula with 6 liters per minute of oxygen flow coming in nasally. So now I'm going to go ahead and check her circulation. So we're going to just feel for her radial pulse, which is we're getting 76 beats per minute, strong and regular. And her skin is warm, pink, and dry. Now, ma'am, are you bleeding anywhere else? Any bleeding whatsoever?
Not to my knowledge, no.
Not to your knowledge. Was there any blood in your stool, urine, vomiting?
No, I haven't been able to stand up since my fall.
Okay. So now, when did you fall?
30 minutes ago.
About 30 minutes ago. And for the signs and symptoms, you said that you're having arm pain as well as neck pain.
Yeah.
Are you allergic to any?
Shoulder.
Are you allergic to any medications or any allergies whatsoever? Come in contact with anything you're allergic to?
No.
Okay. Are you on any medications?
No.
Do you have any past pertinent medical history that might be indicative of, an event like this? Do you suffer from syncope often? Do you fall often?
No.
Okay. And
they're just new roller skates.
Just new roller skates. Okay. And you have you had anything to eat? What was your last oral intake?
About an hour before I started skating.
About an hour before you started skating. Okay. All right. Thank you. That's very good information. And the events leading up to this, you said you were attempting to do a spin move on the hardwood floor, and you ended up falling.
Yeah, I fell out of the spin.
You fell out of your spin.
I just didn't do the move before,
Okay.
and I didn't brace myself well enough.
All right. And now, does anything help it to feel better or worse?
No, it hurts a lot.
It hurts a lot?
It's painful.
Okay. And what's the quality of the pain? Is it stabbing? Is it blunt? What does it feel like? Throbbing?
Throbbing pain through my arm.
Through your arm.
And stabbing pain around my neck.
And stabbing pain around your neck. Okay, do me a favor and just keep your arm nice and stable to your side. So now this patient is
Both arms?
Just go ahead and relax. Well, no, actually hold that arm in the position of comfort for now. So now this patient isn't necessarily critical, other than the fact that she did fall. There's no signs of immediate concern about loss of life. However, my partner is maintaining C-spine because we want to stabilize her spine, just in case there's a C-spine injury. So now what we're going to go ahead and do is we are definitely going to transport, and we are going to, I'm going to have my partner apply a cervical collar here, so that we can get her loaded up onto the stretcher. But before we do that, we're going to do a full body assessment just to check and see if there's anything, we're going to check for our DCAP BTLS, right? Any deformities, contusions, abrasions, bruises, and lacerations, and so on and so forth. So first I'm going to start with assessing her head. We're going to check the scalp. We're going to palpate for any bleeding just in case when she fell, if she hit the back of her head. So we're checking her voids on the entirety of the body first. We don't see any bleeding, so we're further going to inspect the scalp. No bleeding here. We're going to check the ears. No bleeding. We're going to look at her eyes. They're equal and reactive to light. Ma'am, could you open your mouth, please? All right. There's no injuries to the face, no broken nose or anything like that. So now we're going to move on to checking the chest, feeling for any deformities and so on and so forth. Okay, nothing. Now we're going to move on. Ma'am, was there any injury to your genitalia or anything like that whatsoever?
No.
No, okay. All right, so there's no need to inspect the genitalia. There was no injury there, and we want to make sure that the patient feels comfortable and that there's no intrusion of her privacy with regard to that. Ma'am, I am going to put my hands on your pelvis just to make sure that you didn't fracture your pelvis.
Okay.
All right. All right, I'm pressing on the pelvis and I feel nothing. Feeling the ribs, I don't feel anything. Her abdomen feels fine. No hardness. I am going to check her legs and her lower extremities. Was there pain there, ma'am?
My ankle hurts.
Your ankle hurts, all right. So she does indicate that her ankle hurts. So what we're going to go ahead and do is we're going to check for pulse motor sensation. So, ma'am, which toe am I touching?
My big toe.
Her big toe, okay. Can you wiggle your toes for me? All right. And I am feeling a pulse. So she is good on the pulse motor sensation on her lower extremities. So now I'm going to do the same thing for her upper. Ma'am, which finger am I touching?
My index finger?
Yes. Can you wiggle your fingers for me? All right. And I'm checking her radial pulse, and she's good there. So now what we're going to go ahead and do is we're going to apply a sling and swath to this arm here to stabilize it. Now for the intents and purposes of this video, I don't have access to cravats, so we're going to stabilize this to a board. We're tying that, and then we are getting the sling and swath on there for her. So now she's fully stabilized there. She did mention that her ankle hurts, so we're going to actually stabilize that as well using the foldable splint, and then we're going to tie that on 3 places as well here. So now to complete the assessment, my partner and I, while he's maintaining C-spine, I'm going to log roll her onto this backboard here. And together we're going to log roll her onto the backboard. But while we're doing that, I'm also going to be checking her back for any injuries. So ma'am, we're going to go ahead and roll you and get you onto the backboard, okay?
Okay.
All right. So 3, 2, 1. And I'm checking the back of her head, the back of her neck, her ears, her spine, the buttocks, behind the legs, nothing. Okay, we've got the backboard underneath her, and we're rolling her back under. This arm is stabilized in the position of comfort, but also I forgot to mention that while I was doing that, I did place a cravat in her hand to put it in the position of use or usefulness, just in case there's any long-lasting damage there. So now at this point, we are definitely transporting this patient. And while we are transporting this patient, I am going to be taking a baseline set of vitals, which we are going to reassess every 15 minutes because she's not necessarily critical, but we do, she does have injuries that we do want to make sure that we're getting checked out. So what I'm going to go ahead and do is, first I'm going to take your blood pressure. Ma'am, could I have this arm, please? Thank you very much. All right, so for the initial blood pressure, we're getting a 110/70. And we're going to go ahead and remove this blood pressure cuff. I should also add right now we are currently in motion transporting the patient. And I am going to check her pulse. We're getting 76 beats per minute, strong and regular. I'm going to reassess her ABCs. Ma'am, could you open your mouth? Say ah. All right, so she is open, clear, and maintained. Her breathing is adequate. I'm seeing adequate tidal volume, and I'm seeing a respiratory rate of 20 breaths per minute. And her pulse, like I said, is strong and regular. Her skin is warm, pink, and dry. And again, we're going to reassess this every 15 minutes.